Hospitals are a place of healing. You go when you're sick, and you place your health in the hands of trained medical professionals with the expectation that they will give you their undivided attention when need be. Elsa and Sydney Zion trusted a local hospital to treat their 18-year-old daughter Libby, who was suffering from flu-like symptoms. This trust was broken when Libby unexpectedly passed away the next morning. On the night of March 4th, 1984, Libby Zion was at home with a fever. She had been ill for a few days prior, but no symptoms more severe than a fever had been present. On the night in question, Libby's fever was sharply rising, and she was becoming agitated.
It just looked really bad.
Mr. and Mrs. Zion tried to call Libby's pediatrician, but they were unsuccessful. They then called Mr. Zion's own doctor, Dr. Raymond Sherman, who advised them to take Libby to the emergency room and assured them that she would be taken care of.
She said to me, "I'm scared." I said, "You don't have to be scared now. I'll be soon taking you to the best hospital in the world." And I thought that.
Libby and her parents arrived at the hospital at around 11:30 that night. Upon arriving at the emergency room, a medical history was taken. This history included medications Libby was taking, including Nardil, a powerful antidepressant. She was examined by several doctors, including the second-year resident Dr. Maurice Leonard. Dr. Leonard handed Libby off to the care of another second-year resident, Dr. Greg Stone. When they could not determine the cause of her illness, Dr. Stone called Dr. Sherman, who was at home at the time, and they both decided that she was to be admitted for further observation. Once Libby was admitted, she was taken to a room on the 5th floor of the hospital, even though the intern she was assigned to, Dr. Louise Weinstein, was working on the 3rd floor. Libby had been getting increasingly agitated and was writhing around in her bed.
Comfortable. She was moving side to side in her bed. She was moving her arms up and down and from side to side, her head from side to side.
At around 2:45 a.m., the doctor suggested that Libby might be calmer if Sydney and Elsa Zion went home. The Zions decided that if it was best for their daughter, they should do it. As they were leaving, Libby turned to her father and said in Yiddish, "Sleep well, Daddy."
Which means in Jewish, sleep well. And that's the last words I ever heard from my girl.
At this point, Libby's thrashing had removed her IV tube several times. Afraid she might hurt herself, Dr. Stone ordered Libby to be given a dose of Demerol to stop the convulsing. This was the first fatal mistake of the night. After ordering the medication to be administered, Dr. Stone left the hospital to go sleep. Once given the Demerol, Libby became more and more agitated, flailing around in her bed and attempting to remove her hospital gown, for she was too hot. She nearly put her head through a plate glass window while she was thrashing around in her bed. The nurses who were in charge of her were concerned that she still might injure herself, so at around 4 a.m. they called Dr. Weinstein, who first instructed them to administer another sedative, Haldol.
I did not call, but expected to continue to be informed.
When the Haldol failed to calm her down, Dr. Weinstein ordered them via telephone to physically restrain her. Libby was placed in posy restraints with her hands, feet, and torso tied to the bedpost. This was the second fatal mistake of the night. Despite having a high fever when she arrived at the hospital, Libby's temperature was not taken consistently during the course of her short stay. At around 6 a.m., the nurses discovered that Libby's temperature had risen to approximately 107 degrees Fahrenheit, although other doctors who were present later testified that it was as high as 110 degrees Fahrenheit at times. Libby went into cardiac arrest, and despite many attempts to revive her, she was pronounced dead at approximately 7:30 a.m. on March 5, 1984.
I trailed off and I said, "Are you trying to tell me that Libby's dead?" She said yes.
This bright, young woman had essentially fried to death. Sydney Zion, who was a prominent writer for the New York Times, was outraged. He was determined to find out the cause of Libby's death, believing that she died as a direct result of her woefully inadequate treatment at the hospital.
The doctors killed her. That's very simple.
Sydney Zion wrote many articles and gave many interviews detailing the issues that he believed contributed to his daughter's death. The first was that the drug Libby was given, Demerol, was known to have a potentially fatal interaction with her antidepressant, Nardil. When mixed together, the two drugs cause elevated levels of serotonin in the bloodstream. This causes high blood pressure, elevated heart rate, and a high fever.
Foremost contraindicated concomitant with Nardol was Demerol. Contraindicated with Demerol may cause death.
The medication should not have been given.
The second was Libby's restraints. Aside from being inhumane, these restraints made Libby's fever worse than the Demerol had already made it. She was wrapped tightly in place, which only conserved the increasing amount of body heat she was giving off, which led to her cardiac arrest. The doctor's negligence with the restraints was also a potential contributor to her death. Another issue was the lack of Libby's supervision that night. The only attending physician, Dr. Sherman, was at home at the time. Instead, she was left in the hands of inexperienced doctors such as Dr. Weinstein, who was only 9 months out of medical school at the time. It was a recipe for disaster from the start. Yet another pressing issue was that the doctors who were caring for her were working extremely long shifts. "You don't need kindergarten," wrote Mr. Zion in a New York Times op-ed, "to know that a resident working a 36-hour shift is in no condition to make any kind of judgment call. Forget about life and death." There was very little communication between the doctors, so her treatment was ultimately left up to nurses with little experience. Unfortunately, these conditions were not uncommon for doctors at the time. We sat down with Dr. Michael Infantino, a cardiologist in New York City who's been practicing medicine for over 30 years. Dr. Infantino spoke to the conditions he experienced while working in the field around the time of Libby Zion's death.
As an intern, we were on call every third night, and sometimes in the emergency room, we were on every other night. So you worked from 8 o'clock one morning until 5 o'clock the next evening. In the emergency room, you just worked for 24 hours straight. When you were an intern, you were responsible for the entire floor that you were on. So that could be, you're talking about at least about 60 patients. Can thought process be affected by the lack of sleep? Absolutely. And there are certain times when you are getting more fatigued, but it really behooves the individual to make certain that, in between shifts and when they're not on call, that they do get the proper rest and the proper sleep. But yes, it can affect it if it's not really followed closely.
Libby's death soon made headlines all across the country as the people wanted to know who was to be held accountable. Newspapers wanted the doctor's heads on a silver platter, and Sydney was only adding fuel to the fire. However, despite the national attention, Sydney wanted more. He persisted that the District Attorney's Office of New York press charges against the hospital and the doctors who treated her. Charges were brought to a grand jury in 1986, but the grand jury didn't return an indictment. They did, however, agree that some structural changes had to be made to the system. They gave 5 recommendations that they believe would prevent a tragedy like this from happening again. The recommendations are as follows. The first is that all Level 1 hospitals should be staffed with physicians who have at least 3 years of practice and are trained for medical emergencies. The second is that interns and junior residents should be supervised in person by those with at least 3 years of practice and attending physicians. The third is that the Department of Health should set up regulations concerning working hours for interns and junior residents in hospitals. The fourth is that legislation should be enacted to say when a patient may be physically restrained and to standardize their care while in restraints. And the fifth is that the Department of Health should implement a computerized system for checking drug interactions. In response to these recommendations, the Bell Commission, named after its chairman, Dr. Bertrand Bell, convened to discuss the possibility of negligence on the doctor's parts. The Bell Commission's most significant recommendation was that the residents could work no more than 24 consecutive hours and no more than 80 hours in a week. Although not received well from hospitals for its potential costs, these regulations, unofficially known as the Zion Law, went into effect in all 152 hospitals in New York State by July 1st, 1989.
Question. How will you make peace with this now that the case has been decided?
I don't make peace with it. You just have to live, that's all.
In the end, some good did ultimately come out of Libby's death. The compromises on hospital regulations made New York hospitals not only a safer place for the patients, but for the doctors as well.
So the days of 36 consecutive hours every 3 days or every 2 days, that really does not exist anymore.
Based on that terrible thing, we try to do something positive.
Libby Zion's death, while untimely, gruesome, and tragic, was not in vain.